Now, a new survey's revealed a worrying rise in DIY dentistry in the UK.
The Health and Social Care Select Committee says urgent and fundamental reform is needed to ensure everyone has access to an NHS dentist to avoid a dental health crisis.
In the worst cases reported, some extractions were being carried out with pliers.
To discuss this, we're joined by a leading Harley Street dentist and king of celebrity smiles, Dr Richard Marques. Richard, thank you very much indeed for joining us this morning. This is a massive issue. I mean, amongst my constituents, I get loads and loads of complaints about people not able to access an NHS dentist. Why is it so few dentists want to work in the NHS?
Well, I think the system has changed. There's been a lot of publicity about the cuts in funding and how it's been kind of vastly cut back. There's something called units of dental activity, and each practice only has a certain allocation or a certain budget. Once they've run out of the budget that they're allocated, then they're no longer allowed to do any work. So there's a limited budget for each practice, depending on the area, and that's why dentists can only do a certain amount of work on the NHS.
Dentistry always been the Cinderella in the NHS. Have we not taken teeth and mouth hygiene seriously enough?
I think, yeah, the problem is that when the whole health budget's put together, dentistry sometimes gets left behind. And obviously, it's really concerning to hear that people are resorting to DIY dentistry. You know, people should not be doing their own extractions, obviously. That should be done by a dentist. I know that they are trying to increase access for people. It's especially difficult in remote areas where people live, you know, in remote areas far from dental practices. But even in cities where the practices are overloaded, you know, it gets harder and harder to find NHS dentists. The other thing is a lot of the dentists from before, there were quite a lot of dentists from Europe, and obviously now with Brexit, they're not able to come in anymore. So that cut the workforce as well.
Richard, I just want you to say that people shouldn't be, you know, getting their own pliers out and taking their own teeth out, and I think we can all subscribe to that. But I suppose the question is, if people can't access an NHS dentist and they can't afford to go privately, what are they expected to do?
Yeah, it's very, very difficult. There are dental hospitals. So there's dental hospitals which are like the dental teaching hospitals, and the care there is actually free of charge for all patients. So they have like emergency dental services, and they have even some other services for removal of wisdom teeth and things like that. But they're mainly only in urban centres. So again, if somebody's in a more rural area, then it's that problem of having to travel to find an NHS dentist, having to travel a long way, or having to travel to the dental hospitals. Yeah, that's the difficulty.